The opinions and views expressed on this program do not reflect those of the management or staff of Community Media of Staten Island.
Hello and welcome to RUMC Vital Signs. I'm Alex Lutz. On our show, you'll meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, visit rumcsi.org. Do you snore loudly when you sleep? Or even more alarming, do you wake up in the middle of the night gasping for air, sometimes more than once? If the answer is yes to either of those questions, then according to the American Medical Association, you may be one of about 30 million people in the United States who has a condition known as sleep apnea. Today we'll dive into what is sleep apnea, its effects on the body, available treatments, and later on we'll talk not only in depth about a new procedure offered at RUMC that greatly reduces sleep apnea, but we'll also talk with someone who's undergone the procedure and how it's changed his life for the better. Joining me now are Dr. Christopher Lisi and Dr. Priya Sivarajah. Dr. Lisi is chief of RUMC's Division of ENT and Head and Neck Surgery. He's board certified and specializes in adult and pediatric sinus, nasal, and voice disorders. He graduated from an accelerated combined medical program at Villanova University and Drexel Medical School, and also completed an intensive 5-year residency in ear, nose, and throat surgery at the University of Miami, where he served as chief resident. Dr. Sivarajah is a head and neck surgical oncologist and reconstructive surgeon. She graduated from medical school at the Schulich School of Medicine in London, Ontario, Canada, and completed her residency at the University of Alberta in Canada. She also holds a master's degree in public health from Harvard University. Dr. Lisi, give us the 101. What exactly is sleep apnea and what causes it?
Well, sleep apnea is a potentially dangerous condition that probably doesn't get enough talk about it. People think that sometimes snoring is just snoring, but snoring is a major symptom of sleep apnea, and snoring is often not just snoring. It could be this thing called sleep apnea, which is pausing in the breathing at night, which can affect the body's ability to sleep. It could affect oxygen levels at night and can really wreak havoc on the body from a long-term chronic disease perspective. And this is diagnosed in a sleep lab or with an at-home sleep test, which is very common these days, and it can affect both adults and children. It can be very dangerous in the adult population, though.
Wow. Dr. Sivarajah, what are some of the symptoms and risk factors for sleep apnea?
Symptoms can include snoring at night. Sometimes bed partners may notice that people stop breathing, choking, or having these apneic episodes. People can have morning headaches. They usually have fatigue throughout the day. They may need naps throughout the day to catch up with their energy levels. And the one thing about sleep apnea is that a lot of people have had it for many years, so they may not notice how it's affected their quality of life until it gets treated, and then they realize that they have so much more energy throughout the day. To address your second part of your question, the risk factors include sometimes people being overweight can cause sleep apnea. Age, so as you get older, you are more inclined to have sleep apnea. Gender, so males are more likely than females to have sleep apnea. And neck circumference, so if you have a thicker neck, you're more likely to have sleep apnea.
Is it genetic?
It can run in families, actually. We do see that. So if your father or mother have had sleep apnea, you're more likely to have it as well.
I see. And Dr. Lisi, you mentioned a moment ago that it is a dangerous condition. So is it a fatal? Could it be a fatal condition?
Well, it's not that sleep apnea will kill you while you sleep at night,
right.
But what some studies have shown that there are, especially recent studies, that there's some long-term negative consequences on the body. It causes deterioration and problems with the cardiovascular system, the pulmonary system. So people with sleep apnea, they get more heart attacks, they get more strokes, they get a higher incidence of diabetes, which can really be detrimental to the body. There's also an increased risk of arrhythmias, abnormal heartbeats with people who have moderate or severe sleep apnea that's untreated.
Wow. And to both of you, because I know you see patients independent, are you seeing more cases of sleep apnea here on Staten Island? Are you seeing certain trends, like certain age groups, certain demographics?
I think that it's become very common. I think with increasing obesity rates in the United States, which is trending upward in the past several decades, we definitely see more sleep apnea. It's also better awareness these days, which is a good thing. However, I still think the vast majority of people in this country and around the world are undiagnosed and have no idea that they have it.
It's amazing. We had many guests on the show, and obesity comes up for everything, from cardiovascular to sleep apnea, and it really kind of pinpoints, and a lot of people are saying, especially in Staten Island, obesity rates are very high. And apparently that's what you're seeing now too, also with sleep apnea.
Sure.
Now I know everyone's probably heard of what sleep apnea is, what's the CPAP, the noise mask there. What exactly is that mask? How does it help?
Yeah, so CPAP stands for continuous positive airway pressure. So what happens when you're sleeping is you're obstructing your airway. That's how your oxygen levels drop. So CPAP is a way of blowing past that obstruction by providing you oxygen, so your oxygen doesn't drop and you have less of those apneic or obstructive events. So that is the gold standard and first line treatment for sleep apnea. And people will often recognize it because it's that traditional mask that has the tubing connected to the machine that provides the oxygen.
And it's noisy from what I hear. What most people talk about is it's noisy.
I think those machines have improved drastically over the past decade or so. They're smaller, they're more portable. There's you don't have to necessarily wear that whole big face mask. That's one option, but there are smaller, more comfortable masks. But even still, a large subset of patients do not tolerate CPAP mask or CPAP therapy, and there are many other options, some ranging from non-surgical to even surgical options, or even implants these days, such as the Inspire implant.
Well, that's actually what I was going to ask you. The CPAP machine is not something that everybody, you diagnose sleep apnea, they get a CPAP machine. I'm assuming that's more advanced sleep apnea. What are some of the non-surgical ways that you can treat sleep apnea? Can you live with sleep apnea without having any kind of, treatment?
Yeah, it's a good question. Sleep apnea is a spectrum of disease, from very mild to very severe, and somebody with mild sleep apnea may not necessarily be particularly symptomatic and may not need more aggressive therapy. Sometimes for people that have mild versions, there are dental appliances, something called a mandibular advancement device, which you wear on your teeth at night, that's custom fit by a dentist usually. What it does is kind of like it advances the jaw and keeps the tongue out of the airway at night. That can be effective for certain people, but for people that are very obese or people that have moderate or severe sleep apnea as determined on a sleep study, sometimes those types of therapies are not effective. There are a range of other surgical options that can be very painful, so we try to stray away from those for the most part. And there are other treatments like weight loss is really very important for controlling sleep apnea long term, especially in the obese population.
Are there medications that treat sleep apnea?
Not really. I mean, recently, some of the GLP-1 inhibitors like Ozempic, Mounjaro, like the medications that help weight loss have been approved as a treatment for sleep apnea. However, we don't usually recommend that be the lone line of treatment because, as you can imagine, it takes time to lose weight, and meanwhile, you're continuing to suffer from sleep apnea. So we usually recommend, if it is moderate or severe sleep apnea, you get the CPAP machine, in addition to pursuing other avenues for weight loss and reducing the severity of your sleep apnea.
And sleep apnea is something that even children can be affected with, right? It's not something that happens to just adults and older.
It's a little different in the pediatric population.
Right.
I'm a general ENT doctor, so I take care of lots of children and also lots of adults, and I see sleep apnea in both populations. Sleep apnea is a little different in children as it's mainly due to enlarged tonsils and adenoids, and you can usually surgically cure that by removing tonsils and adenoids in a child. It cures it most of the time. In adults, it is removing tonsils and adenoids is not the standard therapy. It's usually not as effective as it is for a child, so we pursue other avenues usually.
And so someone comes to you, they're giving you these, how do you clinically diagnose sleep apnea?
You could diagnose it, like you said, clinically based on patients' symptoms. However, for an adult, really the standard and what is probably going to be used by insurance companies, if something is covered, if treatment is covered or not, is by getting a formal sleep study. Traditionally, these were done in sleep labs. Sometimes these are difficult to get. Almost all adults can kind of get a home sleep test these days, which are pretty easy to do. They can be picked up from a sleep center, they can be mailed to a patient's house directly, they can be set up at home pretty effectively, and that will help make a diagnosis of sleep apnea, and if it's mild, moderate, or severe.
And what does an at-home what does that entail? How do you do that? How do you take the test?
There are different versions. There's different versions, and that technology is evolving. Like year by year, pretty much are coming out with more sophisticated testing. But usually, it's some version of setting up like a pulse ox monitor on your finger to monitor your oxygen. Sometimes you set up a little breathing band around your chest to detect if you're having pauses in breathing, and sometimes a little oxygen or nasal air sensor under your nose to check to see if there's pauses in breathing. There's also other variations these days, like a wristwatch type of situation, a ring type of situation, and these technologies are getting better and better each year.
And is there a certain number of apnea episodes in someone's sleep that you say, okay, this is sleep apnea? Is there kind of like a range?
Yeah, so we go by guidelines. So the sleep reports, they measure how many true apneic episodes people have. They also measure a lesser version of that called hypopneas. So the report will calculate how many of those they have, and then we have a way of measuring the severity based on an index number called the AHI score, Apnea Hypopnea Index. And we have guidelines, so based on where you land on the AHI spectrum, it will tell us whether or not you have mild, moderate, or severe sleep apnea.
I see. And does smoking and tobacco use come into play with sleep apnea?
You know, that's a good question. I think you'll probably hear from most doctors that smoking and alcohol use probably have a negative effect on most health issues.
I've never had one say it's a good thing to do.
Put it this way: I think that alcohol, especially before bedtime, suppresses the central nervous system. It increases snoring and increases pauses in breathing at night. People who drink even a couple of drinks before bed are way more prone to bad obstructive sleep apnea. In fact, one of the lifestyle modifications is to quit any sedating medication or including alcohol prior to bedtime, which can certainly help with this labored breathing at night. Smoking has negative effects on the cardiovascular and lung system, so going hand in hand with sleep apnea that's a bad combination.
And you've both been, how long have you been in medicine now? You're in how many years since you've been?
Oh, I've graduated from my residency 8 years now, but practicing for closer to 13.
And how long have you been?
Oh, geez. I mean, I feel like I've been training for my whole life. But,
there is a question coming, so that's why I asked.
I did 2 fellowships in head and neck surgical oncology, and I've been in practice at RUMC for a little over 2 years.
So in your relatively short amount of time in the medical field, has the ENT field embraced sleep apnea more as a condition that needs to be treated? Have you seen changes in the way it's in just the short amount of time that you've been practicing?
I think the algorithm has changed a little bit because now as ENT surgeons we're offering Inspire implantation as an alternative treatment method for sleep apnea. So I definitely do think we are getting a little bit more incorporated into how patients are being treated for sleep apnea.
Great. And that's going to lead us into our next segment. If surgery is an option, Richmond University Medical Center offers a minimally invasive procedure that is yielding results that are quite inspiring. When we return, we'll talk about this procedure and meet a Staten Island resident who'll share how the procedure has made a difference for him.
We said we'd never give in to a meltdown.
Mariella!
Never leave the house looking, well, and never let them out of our sight. Cars get hot fast, and kids can be at risk. Before you leave the car, always stop, look, lock.
Your life sounds pretty great. Don't let a buzz ruin it. Buzz driving is drunk driving.
We're back on RUMC Vital Signs. We're talking about sleep apnea. We're once again joined by Dr. Lisi and Dr. Sivarajah. Also joining us is James Collins. Diagnosed with sleep apnea, James recently underwent Inspire therapy. the first FDA-approved obstructive sleep apnea therapy that works from inside your body. Thanks for joining us again, and welcome to the show, James.
Thank you, Alex.
So, James, let's start with you. What were your symptoms? What made you seek help, and why did you choose the Inspire procedure?
So my primary symptom was waking my wife up at night, keeping her awake, and like choking during my sleep was the best way that she would describe it.
Okay. When you say keeping you up, not to put you on the spot, it's about snoring?
Yes,
Okay.
snoring, yeah. And I would say extreme fatigue. That was a huge symptom for me. And I needed to stop being so fatigued all the time, and I sought medical attention for it.
And then what about Inspire was something you said, hey, this is something I think...
So I obviously know about the CPAP machine.
You have a CPAP machine? Or you had a CPAP?
No, my father always used a CPAP,
Okay.
and I thought that I wouldn't keep up with the maintenance of it, so I asked about other interventions and found out about Inspire and went with it instead.
So Inspire comes along, doctors. When you have a procedure that comes along that's new, like say Inspire, before you say, hey, this is something we're going to do, what is that process like? The research you do, the training that you have to do to say, okay, we're going to do this and we're going to offer this?
So there's two parts to that question. First is that Inspire has been thoroughly researched prior to it going out as a public option. So the company has published close to 300, maybe 400 articles on it. There's tons of evidence that it works extremely well with higher than 90-95% patient satisfaction rate, and it's extremely safe. So we already know that it works well. And then in terms of training, so as ENTs, we're comfortable with finding the hypoglossal nerve, which is the nerve that helps with the Inspire device. And so we just need, prior to being certified, Inspire, the company, has us go through a cadaveric training session just to ensure that we're comfortable implanting it, so that there's a certification process, and once you get that, then you're good to go for implanting the device.
So walk us through the procedure. So the patient is wheeled into an operating suite, and what happens? How does this procedure work?
So as with every surgery, general anesthesia is induced, they go off to sleep, we intubate them, and then once that's done, there are two electrodes that we put in the mouth, within the tongue and the floor of the mouth, in order to monitor if the device works well after it's been implanted. And so the surgery itself, there's two incisions that we make. One is in the neck, the right neck, and one is in the right chest. Everything is done off to the right-hand side, so that if patients ever need cardiac procedures down the road, you're safe. You're not going to interfere with the device. The procedure itself takes a little over an hour, although with the new gen device that's coming out, that's going to be shortened by half, so it may be close to 30 minutes, and it's an outpatient procedure. So the neck incision is where we find the nerve to the tongue. So when people sleep, they obstruct their airway because the tongue falls back, it collapses the airway. So by implanting this device, it sends an impulse to the tongue. So rather than it falling back, it moves forward. So it opens up the airway and relieves the obstruction. And the chest incision is where the battery goes. So the battery is about yay big, and it's similar to a pacemaker, so it has a 10 to 11 year lifetime. So every 10 or 11 years so you'll need a minor procedure to change out the battery. So that's the procedure. It's two incisions, one in the neck, one in the chest.
So James, if you don't mind, would you just turn to this so I could see your neck? Because there really isn't any kind of real, you say incision into the neck, first thing people think is it's some kind of a scar. And there really isn't. There really isn't, which is great. And then, so now the device is implanted. Is it something that works right away, or is it something that the body has to get used to? How does it work?
So for 1 month, we don't activate the device. So we let the patient heal. The company usually advises 1 month of no heavy lifting or straining. I usually enforce the 2-week rule of no heavy lifting or straining beyond 10 pounds because we don't leave any drains in. So at the 1 month appointment in the clinic, the patient will show up. We'll have the Inspire representative there. We'll activate the device. We'll show the patient how to turn it on and turn it off every night. And then once a week, they'll go up on the strength of the device. So there's a titration period of a couple weeks to a couple months. And this is done until they reach a point where they're sleeping completely and comfortably throughout the night. And it's not causing any issues throughout the night, but we're at a strength where it's treating the sleep apnea. And so once you obtain that level, we do send patients for a sleep study afterwards to ensure that the sleep apnea is treated, and then that will be your level for the rest of your life.
So what's it been like since the procedure?
It's been, I would say, great. I'm very satisfied with the result.
Is your wife satisfied?
My
with
wife
the
is also very
results?
satisfied with the result. She's very happy. Yeah. The first sleep study that I did before the procedure to help diagnose me, I had 141 apneic events during that
Apneic
sleep
events
study.
is stops breathing?
Yes,
Okay.
For 10 seconds at
For
a
10
time.
seconds.
Pausing and the breathing.
You
Yep.
said 124 in an
141.
in an 8-hour span. Wow.
Yes. And the follow-up sleep study is done about 4 months after the procedure. I had one
Wow.
apneic event with the device turned on.
Amazing. Wow. You want to demonstrate?
I would love to.
Go ahead. So now this, you're in bed, you're getting ready to go to sleep. What do you do?
Click the little green button.
Okay.
It's green. Now the thumb.
And that's it. It's not uncomfortable. It's not.
Not
any-
at all. Not at all.
Wow.
In about 30 minutes, it'll stay on for a duration of 8 hours. I mean, you could set the time as well. It'd be 7 hours.
Oh, so there's a timer on that you could set.
Yeah,
your
you
own,
can set it.
your own time.
It's on your phone through an
and,
app.
And you mentioned levels of strength. How do you determine like what would be James's strength level as opposed to maybe mine or Dr. Lisi's?
And so we go based off of the patients, how they're doing, so that when they come back for their follow-up visits, they'll tell us, oh, it was a little uncomfortable for me, then we'll manipulate the voltage or the strength of the impulse that's being activated. So there's a couple like manipulations that we can do, or we ask that the patient just go down one strength level if they find that it's uncomfortable. But everybody has a different, strength that they'll tolerate. But I just want to make sure that everyone's aware that we don't want people to be uncomfortable. The whole point is that you're sleeping well with this device while it's working, and you get a good quality of life by using this device.
And you've not had to change any of your sleep habits, whether you sleep on your side,
No,
none of that?
not at all. No.
That's great.
Yeah.
Wow.
Almost,
That's
almost like nothing has really changed at all, except for using the little remote.
and now you're sleeping better.
And
Your
sleeping
fatigue
better.
is
Fatigue is almost completely gone. I still have other other issues to deal with, of course, but the fatigue really is almost completely gone.
And who's a candidate for Inspire, the Inspire procedure?
A lot of people are candidates for Inspire. There are certain criteria for it.
Right.
And like the main one are people who are diagnosed with moderate or severe sleep apnea. They have to be, beyond a certain weight threshold, but most people qualify for that. People do have to undergo one quick airway endoscopy procedure beforehand under sedation, just to check to make sure the back of the throat doesn't collapse too much for the device to treat. There is such a thing as too much collapse, and a very small portion of patients can't get the device based on that, but we check that prior to surgery. Also, there are some technical limitations. Sometimes insurance companies give a little bit of a runaround with getting it approved. Patients either have to have failed CPAP or not been able to tolerate CPAP, or be unwilling to try it because they're claustrophobic or know that they can't tolerate something like that. And those types of things will make people a candidate usually for the Inspire device. But the vast majority of people would qualify for a device like this.
And you're saying it's about an hour, the actual procedure? So you're not staying overnight in the hospital. You're in and out pretty much in 24 hours or like the same day.
Outpatient, yeah, they go home the same day. It's a little over an hour, but again, insurance companies are coming out, or Inspire is coming out with the new device, which will shorten the time by 30 minutes. So we're looking at maybe 20 to 30 minutes for.
And the good thing about this device is before we even leave the operating room, like Dr. Sivarajah mentioned, there's little electrodes in the tongue, and so we can test the device with that once the device is hooked up to that nerve in the neck, and we could know that the tongue is being stimulated out of the airway. We actually test the device along with the Inspire representatives who are usually present to test the device. We ensure that it's functioning before we even leave the operating room. 99% of the time, that's straightforward and it's working well. Occasionally, we need to, say, reposition the electrode on the nerve or something like that, which can make surgery slightly longer. But Dr. Sivarajah is right, like a little over an hour for this procedure, which honestly is a pretty short time under anesthesia for having a major potential benefit in sleep and health.
And it seems from the lack of any kind of major, this is a small device. This is a small device? I mean, very small?
Yeah, the electrode is like extremely small. It wraps around the nerve, and as you can imagine, the nerve is like 5 millimeters thick, so very small. And then it is tunneled to the battery in the chest, and the battery is about this big. The battery is under the skin, subcutaneous fat. It lays on top of your chest muscles, but unless you're an extremely, extremely thin, usually woman, you're not going to feel the battery at all in your chest.
It's very similar to having a pacemaker.
I was going to say, it sort of sounds like
it's very, very similar to that. It's just on the opposite side of your chest, like Dr. Sivarajah said. We leave the other side of the chest open in case anybody down the road ever has to get a pacemaker. There's plenty of room for that. So this goes on the other side of your chest, and the technology is just like that, basically. Right. And that's been a technology. Pacemaker technology has been around for decades, and it looks and feels very similar.
And Inspire's been around for how long? This procedure?
The first article that was published about it was back in 2014. It's been FDA approved since 2014.
2014, and they're already coming out with a brand new technology. The way technology moves is just amazing. And you have no discomfort in your chest, your neck, like you don't even know it's there?
No, not at all.
Wow.
Really.
That's incredible. As surgeons, this type of a procedure is it fairly easy was like the training, was it easy to learn or complicated or?
Not complicated at all. Yeah, it's pretty easy. I enjoy it. I mean, I'm a head and neck surgical oncologist. This is like one of the only procedures I do that's not cancer related, so I enjoy it.
It's a refreshing change.
Yeah, it's refreshing. I would say for most ENTs, we're very comfortable with anatomy. Most ENTs operate in the neck and the upper chest on a fairly routine basis. These are things that are well within the wheelhouse of most ENT doctors with a small amount of additional training for safety purposes.
And James, leading up to the day of your surgery and then right after, did you have to do anything different leading up to surgery, after a couple of days after surgery?
No, as far as I remember, standard recovery parameters regarding, don't lift anything too heavy afterward. The only thing different, because I've been under anesthesia before, the only thing different was coming in for that pre-procedure to check that the tongue didn't or that the throat didn't collapse. That was the only thing different for me. Other than that, it's in and out of the hospital, a couple hours, go home.
Wow. So, Dr. Lisi, if someone's watching and is thinking Inspire might help them, what would you say to them?
I would say look into it as an option. If you're concerned about your health, if you're concerned about snoring, let your primary doctor know about it, let your physician team know about it, and come see an ENT. Or another sleep specialist if you're concerned about your sleep quality, your snoring, if you're being told that you're snoring by your spouse, and come in and get checked, because this is something that should not be ignored, and people should know that there are many other options other than just a CPAP machine that can be extremely effective for their condition. This is underdiagnosed and undertreated, and there are very, very effective and safe means to treat this these days.
Great. Well, thank you all for coming on the show. I'm glad everything is working out for you and your spouse, obviously, of course. It probably is who's your dad.
Much more important.
If you would like to schedule an appointment with Dr. Lisi or Dr. Sivarajah for any ENT conditions, including sleep apnea, or want to see if you qualify for Inspire therapy, you can call RUMC Center for Advanced ENT, Sinus, and Voice Care at 718-818-1855. The center is located at 1855 Richmond Avenue in the Bull's Head section of Staten Island. Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for over 120 years. You can help ensure that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the donate button located at the top of the home page, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.